Hey, Mr. White, my name's Laura Stewart, and I'm a nursing student here at the University of South Alabama. Is it okay if I do your musculoskeletal assessment today? All right, I'm going to perform some hand hygiene. So now, as I'm going to start, I'm going to inspect your knees. They are the same color tan as yours. I see no abnormalities like any kind of masses or anything on them. No bruises, no scarring. I do see a little scar. Does it hurt or anything like that? Cause you any kind of pain?
No, it's from a previous injury.
Okay, so now I see no deformities. So now I'm going to palpate your knees.
Okay.
Is there any kind of tenderness?
Nope.
All right, and I feel no swelling or abnormalities. The temperature is slightly cool, but is equal in both the knees. So now I'm going to check your muscular strength. So I'm going to have you do your arms like this.
Okay.
I'm going to push against them, you push against me. I'm going to pull against them, you pull against me. So this is a 5 out of 5 on your upper extremities. Seems very good. So now I'm going to try to do your lower extremities.
Okay.
So now I'm going to have you lift your legs up against resistance. So I'm going to push.
Okay.
I'm going to pull. Nice. So 5 out of 5 on your lower extremities and upper extremities on your skeletal muscular strength. Now I'm going to have you stand up for me. You took off your socks and your shoes for you. So now we're going to check top to bottom your range of motion. And I'm going to observe for any kind of abnormalities. So now I'm going to have you open your jaw. I'm going to have you push it out. I'm going to have you move it side to side. So now we're going to check your neck. You're going to put your chin to your chest. And then you're going to extend it back normal.
Oh, okay.
And then you're going to hyperextend it back, okay?
Okay.
Great. So now I'm going to have you do a lateral bend without moving your shoulders. You're going to move your right ear to your right shoulder without moving your shoulder.
Oh, sorry. Okay.
So now you're going to do your left. All right. So now I'm going to have you do your shoulders. You're going to put your arms straight out for me. Then you're going to extend them to your sides.
Okay.
Right
Oh,
here.
okay.
Straight down. Then you're going to hyperextend it so it's straight back.
Okay.
You're going to adduct them straight up and adduct them straight down.
Okay.
Then you're going to bend your arms and rotate around your back for an extra range of motion. So do it to the back of your head too.
Okay.
Great. So now we're going to check your elbows. So you're going to put them straight out in front of you like this. You're going to do your fingers apart. So now you're going to put them out in front, straight out,
Okay.
wrists flat. So hyperextend them like this. Okay, so now do it like this. And then you're going to supinate your fingers towards the ceiling with fingers apart.
Okay.
Now you're going to do your wrists.
Okay.
So now I'm going to have you do your hands like this. Flex your hands down,
Okay.
straight out, extend straight out, hyperextend towards the ceiling. Now I'm going to do a radial duration. Put your fingers together. An ulnar deviation doing like this,
Okay.
pointing out. All right, so now we're going to have you do your fingers. So you're going to have them flex, so extend regular, hyperextend, extend down, make a fist, so abduct it, then spread them out, adduction. Then we'll have you touch your thumb pad to each of your fingers. And now I'm going to have you touch the thumb to your little finger, okay?
Okay.
So now we're going to do your hip, your lower extremities.
Okay.
So with one leg, we're going to have you lift your knee up and flex.
Okay.
Then extend it straight down. Kick it back to hyperextend. Then we're going to have you abduct your leg straight out to the side.
Same leg or the same leg? Or
Yeah.
okay.
So we do it just one leg at a time. And now I'm going to have you rotation just like this. External rotation,
Okay.
external rotation, internal rotation, external rotation.
Okay.
All right, so now we're going to do it with the left leg. So extend straight down,
Okay.
kick it back,
Back.
kick it to the side,
Okay.
straight out,
Straight up.
internal rotation, external rotation.
Okay.
All right. So now we're going to do your knee. You're going to go straight up and flex it. Extend it, strand regularly. Then I'm going to have you hyperextend it and lock it out. Great.
Okay.
So now I'm going to have you do your foot. You're going to point your toe to the floor. This is plantar flexion. Then point your toe to your chin. This is dorsiflexion. Then you're going to turn the sole out, which is eversion, and sole in, which is inversion. Then I'll have you curl your toes, which is flexion, and then I'm going to have you spread them out, which is extension.
Okay.
Very nice. So I see you have full range of motion and there's no depreciation. So now I'm going to check your spinal flexibility. You're going to bend down towards the floor.
Okay.
Try touching the toes. Then you're going to stand right up, which is extension. Then you're going to go 30 degrees back, which is hyperextension.
Okay.
Very good. So now I'm going to have you do a lateral bend. So you're going to try not to move your hips, but you're going to go side to side. And now you're going to do a rotation while keeping your hips.
So stationary or?
Yeah. There you go.
Just keeping real still?
Right.
Okay.
All right. So now I see you have full range of motion with no abnormalities. So now I'm going to look at your spine. I'm going to have you turn around for me.
Okay.
So at this point, I would be straight behind my patient like I am now. The gown would be open in a setting. And I'm going to have you, I see that your spine is straight, your shoulders are even, and your scapula is even. Your iliac crests are also even. So now I'm going to have you turn towards me real quick.
Okay.
I see that your cervical spine is concave, your thoracic spine is convex, and your lumbar spine is concave, okay?
Okay.
Okay, so now turn back around.
Okay.
Cervical spine is concave, thoracic spine is convex, and the lumbar spine is concave. So now I'm going to have you bend over, and I'm going to look for any kind of abnormal curvature in your spine, which I see none, so I see no sign of scoliosis. Your shoulders are still even. There's not one higher than the other, and your scapula is even. Your iliac crests are also even. So I see no signs of scoliosis on you. I see full range of motion with doing the assessment. So it looks like your musculoskeletal is greatly intact. So thank you so much.
Thank you.